The health system. Health system. Understanding Australian health system. Where and how to get the health care you need, when you need it. Different levels of service. Public system, private system. There are two types of health systems in Australia. There is the public health system funded by government. People using this system must have a Medicare card. The private healthcare system is funded by individuals who pay for their own health care. This information is about the public health system because it's cheaper and good. If you are a permanent resident over 18 years of age, you must have a Medicare card. Asylum seekers are not eligible. Complete an application form from one of the Medicare offices or download one from the Medicare site on the Internet. If you need help, your settlement service will help you. You must show a Medicare card when you go to any medical service anywhere in Australia. You also need it to buy prescription drugs from the pharmacist. Medicare is a health fund paid for by Australian taxpayers. It covers costs for treatment by doctors, optometrists, medical tests, some medicines and some dentists. It also covers some costs of the hospital care and support for mental illness. You must tell Medicare if you change address, telephone, or personal details. Keep your card with you at all times. People on Centrelink benefits can get healthcare concession card. This card can be used to get cheaper medicines at the pharmacist. If you show this to the driver, an ambulance is free. It can also be used to get cheaper gas, electricity, and public transport tickets. Look for doctors and medical services with this sign. Bulk billing means you do not have to pay the doctor. Medicare will pay. You will show your Medicare card and sign a form. If you don't do this, you will be sent a doctor's bill. If there is no bulk billing sign, the doctor will charge you. You have to pay the full amount and then claim it from the Medicare office. You must get a receipt to take to Medicare. Different levels of service. There are 3 levels of service: local health centers, specialist doctors, and hospitals. There is also an ambulance service for emergencies. Local health care. For most medical treatment, you should go to your doctor's clinic, dentist, or maternal and child care center. Go here first, not the hospital. Try to use the same doctor so they get to know you and your family. Making an appointment. You need to make an appointment. If you need an interpreter, ask for one when you make your appointment. You do not pay for the interpreter. You can ask for a male or female doctor when you make the appointment. You make a separate appointment for each family member and make sure you arrive on time. If you can't keep the appointment, telephone to cancel it. Everything you tell the doctor is confidential. Specialist doctors. Your doctor may refer you to a specialist if you need special treatment. For some tests, the doctor may refer you to a pathology clinic. You may have to telephone the specialist to make the appointment, or the doctor may do this for you. Some specialists have long waiting lists. You will have to pay a private specialist, one that is not in a hospital. Hospitals. Remember, there are public hospitals and private hospitals. Private hospitals are expensive. For major treatment, the doctor may refer you to a hospital. The doctor may also send you to a hospital for minor treatments that she cannot do in the clinic. Do not go to the hospital for everyday care. Go to your local doctor. Public hospitals. You will probably have to wait a long time for a bed in a public hospital if it is not an emergency. Public patients cannot choose their own doctor or specialist. They usually share a room in the hospital. You will be served meals in the hospital. Tell them if you have special dietary needs. Check what the visiting hours are. If your child is sick, you might be able to stay in the hospital with them. In an emergency, you can take the patient straight to the emergency department of a hospital. If it is life-threatening, call 000 for an ambulance. If you need an interpreter, call TIS, T-I-S, on 131450. Important things to remember. Take your Medicare card when you go to the doctor. Try to find a doctor who bulk bills. See your doctor for regular medical matters. The doctor will refer you to a specialist or hospital if necessary. Only call an ambulance in an emergency. The Health System, Ames, March 2008.